we're so used to AI without actually realizing it. We're continuously using Google Maps to find out when we're going to be somewhere, what the best route would be. We use predictive text in our messaging. We order things online from Amazon, etc. There's so much AI and data science behind all of that. And then the moment we step into a hospital or a clinic, we kind of go back to the 90s where we're still faxing, maybe not. And it's a very interesting, I feel like, for most people who work in healthcare, that you kind of accept that that's the status quo, and that suddenly we have to go back to a system and a medical record that looks like it's built for Windows 95, for example. And we kind of take for granted that the rest of society has leaped forward these past 10 to 15 years.
Hello and welcome back to the Business and Medicine Podcast. I'm your host, Adrian Kutstrup, and we have a very exciting episode ahead of us. Today we're talking to Dr. Martijn van der Meulen, who is a recently graduated MD from Radboud University Medical Center in Nijmegen, Netherlands, who has worked in internal medicine and acute care, combating the COVID pandemic on the front lines as well as in public health. During his studies, Dr. van der Meulen worked for numerous departments of the Radboud University Medical Center and its Reshape Innovation Center, implementing healthcare innovation. He participated in Singularity University's Exponential Medical Conference and created the Tanzanian Treatment Guidelines app, which is used by over 3,000 clinicians in Tanzania. Dr. van der Meulen teaches e-health and the fundamentals of AI to undergraduate students in medicine at the Radboud University. He's also the founder of Plexus, an AI startup that helps Dutch medical students uncover their knowledge gaps. Thank you for joining us today and welcome to the podcast.
Thank you very much, Adrian. Thank you for inviting me and thank you for the great introduction.
Great. So I guess before we begin, you're based in the Netherlands. How is it over there with the pandemic going on?
Well, it has its ups and downs. So we're currently, actually, the last couple of weeks, our infection rates have been climbing again. So the Dutch government has implemented kind of the same system as in France, a pass sanitaire, where you have to prove that you're either tested, vaccinated, or recovered from COVID in order to go to a restaurant, cafe, bar, whatever public place you want to go to. So in the public debate, it's becoming a bit more polarizing. People are also, against the use of these kinds of measures.
Yeah, and they're doing the same thing in Ontario with the vaccine passports, they call them. So I know at my gym, if you're not double vaccinated, you're not working out.
Yeah. In Italy, they went even further because you can get up to a €2,000 fine if you're not vaccinated, even if you're self-employed. So
Really?
That's one of the strictest regimens, I'd say, in the entire world.
No kidding. Yeah. Before we started the podcast, you were mentioning kind of the road to medical school and how it differs a little bit from how students in Canada and the United States get into med school and become physicians. Could you give us a brief summary of what we were talking about?
Sure. So in the Netherlands, you have different levels of high school. You actually have 3 levels, and you can only go to the university if you graduated from the highest level. And then you can specifically only apply for studies such as medicine if you've done one of the curricula that holds both physics, chemistry, and mathematics. In the Netherlands, you have about a 1 in 3 to 1 in 4 chance of getting into medicine based on, they have 2 types of, let's say, selections, we call them, or one is basically a lottery, kind of based on your exam results. And the other one is based on a resume and kind of extra exam you do at the specific university in which you apply. Medicine is the same as any other university degree, in which you have a bachelor of 3 years and then a master of 3 years. The bachelor is just lots of biochemistry, clinical reasoning, etc. And then in the master phase, the last 3 years, you go into the clinic and you do your clerkships. And at the end, you have to do a research project, and then you graduate, you can apply for the registration that you're an MD.
Right, that's great. Gives everyone some context, kind of some how it can differ from country to country. So why don't we start with learning about how you got interested in software development and some of the projects that you were working on at the Reshape Innovation Center.
Sure. So we'll have to go back a couple of decades, actually. I turned 29 2 days ago, but I actually started building websites when I was in my final year of elementary school. I was about 12 years old. Kind of a funny story, actually, because I had won a web domain and I had no idea what to do with it, but my friend from school was really into radio and web radio stations. So we decided together to kind of build our own radio station, but it obviously needed a website. So it's kind of how I started with HTML, CSS, and then into PHP, and kind of kept going. And then in high school, I met a very good friend who eventually went on to study informatics and is currently an IT engineer. And we had a lot of classes together. So we used to do all kinds of things in Python and PHP and, build some websites together. So it's kind of how it started. And maybe also interesting because I started studying medicine, having an idea of, kind of closing that book, keeping that behind me. And then I think after about 1.5 or 2 years, I kind of got bored in the curriculum. I was also not sure if medicine was really the path forward for me. And then I stumbled upon the Reshape Center, which was newly opened at that time. And it turned out that having a little bit of a software background in healthcare is very beneficial. So at Reshape, which is a program part of the University Medical Center, meant to help departments of the medical center innovate. So we were looking at how can new technologies such as virtual reality, which was really up and coming at that time, or e-health, for example, help increase quality of care, decrease workload of clinicians, etc. And we did a lot of pilots in which I was also either working together with a couple of software engineers or building a very simple web app to kind of show the people, is this, what you're thinking about? Could we use this in a pilot, for example?
That's great. I love how you kind of took that first interest in software development, then you were able to use those skills as a medical student and physician. I think that speaks to the importance of a diverse medical school, how people can bring in these diverse talents and really contribute in a positive way to the medical field.
Absolutely. And I think also something that we're definitely going to talk about is how important it is to have a diverse group of people, also in the sense of personality and in the sense of ambitions and vision for a future. Because so many of my colleagues kind of had the notion of studying medicine, and the usual story is that they were 6 years old and they already knew they wanted to become a pediatrician, for example. And I think it's also very important that there are kind of the outliers as well, who are maybe they don't necessarily fit into the group, but for some reason they were involved in IT or in entrepreneurship or you name it, something that's, art, whatever, but they can bring so much more value to the table than just having a team of people who think the same way, work the same way, and have the same background and experience.
I 100% agree. You're able to take kind of that outside the box approach to thinking about how you can solve different healthcare problems. I think maybe it'd be beneficial to give our listeners maybe a definition of artificial intelligence. And I think that's going to be the biggest topic of our discussion today. And then once we define artificial intelligence, maybe you could describe how it's currently used in healthcare.
Okay, well, that's a very good and also quite a difficult question because there are a lot of definitions. Usually when I talk to clinicians about AI, I kind of draw a parallel between clinical reasoning and AI. So a very common example is when a patient enters the emergency department with a fever, it's more likely, obviously, that they have a urinary tract infection, for example, than some kind of very exotic interleukin-1 antagonist deficiency, you name it. And so what do? We use epidemiology, and we use our experiences to kind of predict what's the most likely diagnosis. That's our differential diagnosis. And then we take actions based on that most likely prediction. And AI is basically doing the same thing, but allowing computers to do it with sometimes many more factors. So the more information you have, if it's a young woman, for example, your differential is different than when it's an old man with fever, etc. And it turns out, as humans, we're very good at combining 2, 3, or maybe 4 of those factors. But obviously, computers can combine hundreds of those factors. For example, someone's DNA, someone's race, etc. Things that wouldn't be very obvious for us as a human to take into account, but it allows computers to predict very precisely what's the most likely diagnosis, and going forward, what's the best course of action. I guess that's AI in the context of what it can do for healthcare.
Right, and especially in clinical management, it sounds kind of crafting that differential. Are there other domains of healthcare that you think benefit a lot from artificial intelligence? So we spoke on that differential diagnosis and that initial patient encounter. Are there any other areas?
Absolutely. I think even, clinical reasoning, it's a great example because it helps people understand what AI could do. It's part of predicting something, but actually using AI in a setting where doing clinical reasoning or creating a differential is still, I think, far away from reality. Where we're already using AIs, for example, in radiology, we're able to enhance CT scans or MRI slides with AI, where we can now use less radiation, for example, to get the same quality of images. And another great pilot they're currently doing at the Leiden University Medical Center is using speech to text to kind of remove the keyboard from the doctor-patient interaction and just having the patient and doctor talk to each other, removing the administrative burden. And then after the visit, automatically there's a summary of what's been discussed, and you can get the entire transcript as well. So I think there are many different areas within healthcare where AI can really be a win-win for us.
Yeah, for sure. I think being able to allow physicians to have that one-on-one interaction with the patients in such a time-sensitive appointment where you're trying to jot down all the important information, but then it's distracting you from that personal human connection. So I think that's another great reason to implement AI.
I was just thinking about, most people study medicine because they want to help patients. They want to, they're very social people. And then it turns out after a couple of years of undergraduate studies that we basically have a desk job with a computer in front of us all the time. And so that's a difficult reality for a lot of people. Whereas I think we should ask ourselves more, how can this computer kind of help us? And how can we maybe remove it from the equation if it hampers the doctor-patient relationship as well?
Exactly. And another way I think AI has helped or is able to help with the incredible amount of new knowledge that we're getting in medicine. There's so many new studies coming out, so much new information. We need computers to be able to sort through everything because it's not manageable for humans to do it by themselves, right?
Yeah. And actually there is a different pilot, which is more towards pharmacy, I think, but it's a small startup in Amsterdam, which is run by pharmacists and data scientists together, a very interesting combination. And they're writing a natural language processing algorithm that does exactly what you just mentioned. It kind of, you put in factors you want to compare, for example, salbutamol versus a different corticosteroid or something, and then look at some kind of outcome. And then the natural language processing algorithm will kind of screen all these different locations, PubMed, etc., to find out, what would be the most beneficial drug in this situation. Because, yeah, true, there are thousands of new articles coming out every week. It's impossible for any one human to read all of them and stay up to date.
And now a word from our sponsor. This podcast is sponsored by OMA Insurance, the exclusive provider for the OMSA and the CFMS. Well over half of the medical students in Ontario choose and trust OMA Insurance because they are a wholly owned subsidiary of the Ontario Medical Association. As a not-for-profit and using the group buying power of well over half of Ontario physicians, OMA Insurance provides a wide range of insurance and retirement savings solutions for medical students, residents, and physician members. They have non-commissioned staff who offer objective advice, education, and solutions. OMA Insurance can help you prepare for the unexpected and help get you back on your feet when you need it the most. For instance, did you know that if you take more than 6 weeks off of medical school, you have to restart the year again? And if you're off for 6 months straight, the bank can start to ask for repayment on your line of credit. I personally have disability coverage with OMA Insurance. I got it because school is stressful enough, and I believe it can help keep me and my finances safe during times of uncertainty. Plus, it's affordable and super easy to enroll. Make sure you're protected, because if the last 2 years has taught us anything, it's that life can be very uncertain. OMA Insurance is there to protect you every step of the way. Go to omainsurance.com to learn more about our special offer and exclusive savings for students.
So we've seen what AI could do in healthcare, so a lot of the benefits, but I'm assuming there's a lot of challenges in implementing AI and maybe societal backlash to AI. I'm wondering if you could talk a little bit more about some of these challenges.
Absolutely. And, I think it's always very interesting that, we're so used to AI without actually realizing it. We're continuously using Google Maps to find out when we're going to be somewhere, what the best route would be. We use predictive text in our messaging. We order things online from Amazon, etc. There's so much AI and data science behind all of that. And then the moment we step into a hospital or a clinic, we kind of go back to the 90s where we're still faxing, maybe not. And it's a very interesting, I feel like, for most people who work in healthcare, that you kind of accept that that's the status quo, and that suddenly we have to go back to a system and a medical record that looks like it's built for Windows 95, for example. And we kind of take for granted that the rest of society has leaped forward these past 10 to 15 years, especially thanks to. And I was always interested, why is that? I think there are kind of three main factors at play. One is definitely, I would like to call the law, basically, in that organizations such as Amazon are the survivors of others who weren't innovative enough. So there's a certain survivor bias of companies that are maximum investing the most they can in R&D in terms of data science and AI and IT, etc. Whereas healthcare is protected by an umbrella of the law. We are the only ones who are allowed to practice medicine. We're the only ones who are allowed to give drugs, for example. And so it's more difficult for other organizations to come from a different sector and disrupt the field of medicine, which is also, I think, the same reason, coincidentally, that the judicial system and education, which are also kind of public entities protected by the law, are also conservative, not very innovative. You can't really disrupt them because they're the only ones who are allowed to do something in our society. And that comes into the second factor, which is that allowing for an organization to be protected from disruption kind of creates an environment and attracts people with a more conservative personality, I think, is more or less my hypothesis. But we are educated, we practice evidence-based medicine because we're afraid everything that's new is potentially harmful and dangerous for our patients. So we'd like to only do everything by the book, ideally a book written in the 70s or the 80s, of which we know that it's been repeated often, time and again, and we're very sure that we're not doing any harm. But the flip side of that is that it kind of removes innovation from the equation. So it makes it more difficult for us to have people in our environment, in our working bubble, I'd say, that think outside the box, are more creative and come up with crazy ideas and say, like, hey, next week, let's do it totally different and we'll see what will happen. If you work in Google or Amazon, I think that that's what's expected from you, whereas in healthcare, people will look like you as if you're crazy. And then the last partly the personality idea is that it's very difficult in such a fast-paced environment with such a workload to step back and think about innovation and think about the future of the work we're doing. So I think the balance between reflecting about what happened before and thinking about history and maybe things that could have been better, doing what we have to do right now, a full inbox, a load of patients waiting, etc., the workload of today. And then the third one is taking a step back and thinking, well, where do we actually want to go? Are we on the right track, or should we do something different? And are we happy with the current status quo? And finding that balance, especially if you're a young physician in an old system where you're also kind of looking up in a hierarchy sense to people who've been in the system 20, 30 years, who are your superiors. I think it's very difficult to have the freedom of saying, well, no, listen, we need to take a step back. What we're actually doing every day, this and that, we should really change, because they did it in the 90s. We don't have to do it anymore because now we have AI, for example, as a solution.
I love how you framed it in that 3-part framework. I think that really, it makes a lot of sense why healthcare compared to other fields is lagging, for a lack of better words, in the artificial intelligence space, and really just innovation in general. I think 2 things that really stood out for me was the mindset. So when you put it into the context of someone at Google, they're encouraged every day, think outside the box. We want to hear your craziest idea. And I think that really puts into context the business side of it, where these crazy ideas are what makes Google or Amazon stand out among the competition. Whereas healthcare, even though it is a business, I don't think people think of it as a business in the same way. Whereas we should be thinking more about how can we increase efficiency? How can we decrease wait times? Like, these are critical issues that things like in artificial intelligence and other innovations could seriously help with. And the other thing I like that you brought up was the workload and the focus on patient well-being. I think doctors are in general, very overworked, and a majority of their days are taking care of patients, and they don't have that time to take a step back and really think about, okay, how can we do better? How can we improve our system? I guess one way to kind of think about it is, you, by changing and by incorporating some of these innovations, you'd be able to improve patient care and do better for your patients.
Absolutely. And I think that on a larger societal level, we have a role, maybe arguably even an obligation to society to talk about these things, because we are part of kind of the problem, the issue of healthcare being such a costly business, such a costly part of society, but also, people getting ill because of the environment in which they're living, for example, the importance of prevention of disease. And the interesting thing is that in most societies, physicians are still kind of regarded as a high status. People listen when the doctor is speaking, but there aren't many physicians who are really in the public debate and maybe kind of leaning towards even medical activism, where I think it's necessary, both in our work, that at times we have to use our fists and say, well, listen, we don't want to work the way we're currently working in. We want things to change, and otherwise we're going to go on strike or whatever. We need to discuss these issues. But also on a societal level, we need to be seen and we need to be heard. And what makes it difficult is that, to come back to why are people choosing for medicine, because they are friendly, nice people who want to help others, relatively social, adapt easily to new circumstances, to a new environment, and not necessarily kind of the red color of personality who are, slightly more aggressive tone of voice maybe, and who aren't afraid to stand up to superiors and say, well, listen, what's happening right now is crazy and we need to change the system.
For sure. So, I want to go into more how medical students can start to get into the field of artificial intelligence and where they can learn more. And I think a good way to segue into this would be to learn a little bit more about Plexus, the AI startup that you started to help Dutch medical students uncover some of these knowledge gaps.
Sure. So about Plexus, so as you mentioned, so Plexus is kind of an app with an AI, simple AI backend that helps medical students find their knowledge gaps. So what we're basically doing, we have a database of exam questions of different topics, and we've categorized and labeled and tagged all of those questions. And then we've asked a number of students to basically practice with the questions. Then we've trained a model, say, to look at what specific topics you are having difficulties with and where could you most efficiently invest your time in to improve your score, for example, or to get better in a certain area of medicine. So I started that project because I noticed that we have so many exams and there is a lot of emphasis on lifelong learning, but theoretically you can pass all of your exams just barely and still get the degree and still get an MD. And they've actually in the Netherlands noticed that a lot of residents have difficulties prescribing medication, that they don't know what the most important side effects, interactions are, etc. So their solution was to add another exam instead of, let's review it, see what are your knowledge, your personal knowledge gaps of the past, I don't know, 12 to 18 months, and what's the most efficient way for you personally to improve on those.
And another thing I noticed, you were developing a workshop on AI for healthcare providers. Could you tell us a little bit more about this initiative?
Of course. So I'm part of a group of young physicians and pharmacists. It's called the Working Group Healthcare 2025, something like that. And it kind of goes back to what we were talking about earlier. Young physicians who feel like we should take kind of a more important role in society, etc. So there are groups on sustainability, prevention of disease, etc. And then AI is one group. And what we are doing is kind of developing from A to Z a workshop for clinicians, nurses, etc. Anyone in healthcare who's interested in AI, to kind of touch on the basics and kind of reveal also the mysterious black box that a lot of people feel AI is, and really get into what's most important if we want to use AI in our daily jobs. And in a workshop, we are taking the participants through a kind of checklist, through the procedure of starting with an idea, kind of, like Steve Jobs in a garage, all the way up to actually implementing it in your ward or your clinic, for example. And what we want to do is uncover that, yes, AI in healthcare is a difficult topic, and there are a lot of things you need to be aware of if you want to implement such an innovation. But at the same time, it's very graspable as well. And it's more important that you realize, hey, this idea could really mean something for me. The quality of care improves, or my workload decreases, etc. We want to do something with this. And then what necessary steps and what people do I need to involve in this program, in this idea, in order to go to implementation?
That's great. And it kind of sounds like it's addressing that first barrier in innovation and acceptability of AI in healthcare, of how outside organizations, it's a lot difficult for them to make changes in healthcare because, as you said, it's regulated by the law. Only physicians are able to prescribe and treat patients. So when you're able to provide physicians with a framework to be able to make tangible improvements themselves, that I imagine makes it a lot easier to start some of these innovations and improvements.
It's absolutely, and it's still very difficult. Obviously, people are naturally wary of, what is this new idea you're talking about? Could it also fail? What are the risks, etc.? And so, what we're also doing in the Netherlands, involved with the Ministry of Healthcare, to kind of develop such a guideline for innovators in healthcare AI to prove that they've really thought of everything that's important. So all the potential risks of actually using and implementing AI in healthcare, we wrote them down, and we hope that it helps clinicians who are at the end of the day the decision makers on their ward or in their hospital understand that it is possible to safely use AI in healthcare, and we can prove that we've really got all the risks, did a good risk assessment, privacy impact assessment, all of the necessary things to safely use AI.
So, from a student's perspective, if one of our listeners is interested in artificial intelligence, do you have any advice on how they could start to learn more, especially students maybe with very limited software skills, such as myself?
A great question. And I'd say that there are two ways. If you're interested in really getting into AI and software itself, then there are loads and loads of great courses and massive open online courses you can Google. So many great YouTube channels as well that have a great explanation about how AI works and what its benefits are, etc. But I think maybe more important is to start talking to other people and find out, hey, are there others who also feel like, AI in healthcare, it's important. I'm not sure what it exactly is. Can we team up and can we do something together? And the interesting thing is that, a couple of doors somewhere else in this building, there is an IT podcast, undoubtedly, of software technicians, software students talking about exactly the same thing. We're working in AI. Healthcare is such an interesting space. You can make so much impact on a person's life. How can we get involved in health? If we can get these two worlds to find each other and talk to each other, you can really create some great projects.
And one thing I imagine a useful skill for this field would be collaboration and networking. As a medical student or physician, you're in the operating room in the hospital, so you're seeing from a first person lens some of the issues in your healthcare system, and then being able to network with, as you mentioned, software engineers, individuals, experts who can design specific technologies to address some of these things. This partnership, I think, would go a long way in being able to implement some very good strategies.
We usually don't speak the same language, and I'm involved in a software project right now for the public health system in the Netherlands. And it's difficult at times because clinicians have a different view and a different way of describing what they want than most software engineers are used to understanding. But it's all the more important to be, part of the process and be interested in it, and to, show them, take them, go together, show them what you, and to learn from each other. We don't have to become IT specialists in healthcare, but we do need to be able to explain what we want, what our goal is, and sometimes what we're afraid of.
I know we're running out of time here, but one other kind of question I wanted to address is just the interaction of artificial intelligence and entrepreneurship. So how do these fields coincide with each other, and why is it important to develop strong entrepreneurship skills if you want to enter that artificial intelligence space?
There is not a single healthcare innovation that is sustainable without a good business model. If you want to have your project survive, it needs to somehow pay for itself in a system where payments is becoming one of the most important factors. And entrepreneurship, in a sense, is much more, I think, about communication. Can you find the right people to come together as a group and to do something? And I think that maybe the most important part of entrepreneurship is having others around you who have certain skills that you don't have, that you don't possess. And together there's a compound kind of benefit which allows for great, for example, Plexus would have been impossible for my colleague from informatics because I have the faintest idea of how to develop an AI algorithm, or another colleague from law who was able to get the marketing together, for example. So thankfully, as medical students or clinicians, we're already inclined to have these social skills, but we need to find people outside of our own bubble of colleague medical students. We need to go to other places where we can find people who think differently than we do.
Exactly. So on a final note, what would you say, in your perspective, what does the future of artificial intelligence look like in healthcare?
But there's a great book from I think Avi Goldfarb and two other professors from Canada. It's called Prediction Machines. So if you're very interested in AI, you should definitely read it. And their book is to summarize it, about what parts of our society will be disrupted by AI. And those parts in every sector, so healthcare, just like any other, those parts where you can predict something will be automated by an AI algorithm. So think about it. A lot of things we do in healthcare are decision based. So there needs to be someone responsible for it. But there are also a lot of parts where we are simply inputting data into a computer, or we are doing some kind of clinical reasoning process. And I think that the next few years, we're going to see slowly but surely these prediction parts of our jobs will be automated, simply because it's cheaper to have a computer do it than a human.
I think the future in healthcare, there's going to be a lot of changes. I think, with the aging population and so many improvements that can be made. I think it's going to be an interesting next few decades, that's for sure.
Absolutely. And with the rising healthcare costs in OECD countries, aging, there are a lot of issues. And the only ones who are really able to solve them are the ones within the system who are able to think outside the box.
Exactly. Well, Dr. Van der Meulen, thank you so much for taking the time to be here with us today. It's been a pleasure talking to you and learning more about your experiences as a physician entrepreneur and the world of artificial intelligence and the impact it has and will continue to have on healthcare. Thank you to our listeners for tuning in. If you have any questions or show ideas, please email us at businessandmedicinepodcast@gmail.com, all one word, or follow us on Facebook at Business and Medicine Podcast.